Good evening, everyone. My name is Brighton Ncube. I'm the Chief of Ambulatory Operations for RUHS. So I have the privilege to start us off with a devotion. But before I go further, let me dedicate the building to give our wishes for this building. This is a magnificent building, and we look forward to a lot of good things happening in this building. So we wish right care at the right time and setting, exceptional patient and staff experience, to continue with innovation to provide the best service possible, to provide holistic care. We will respect the rights of our patients. We wish for patients to benefit from our integrated services, that is public health, medical, and also behavioral health. And as a safety net provider, no one will be denied services because of their inability to pay. And we wish we will continue to thrive to address diversity, equity, and inclusion. This is our prayer as we dedicate this building, that our patients benefit a lot from this building. They get the best of all services that are provided in this building. So if you will, or if you are comfortable, we can bow our heads for prayer now. Heavenly Father, we are here this evening to recognize the opening of this great facility. As we open its doors to provide services and care for the community, we acknowledge that we are an extension of you in caring for others. We humbly ask that you give our team of providers and staff the grace to be good stewards so that they can use their talents and expertise in providing care to all those seeking treatment here with a sense of hope and healing. This past year has been a very difficult and challenging one for our community and for our nation. We ask that you help our team of providers and staff to continue to remain diligent even during these difficult times, and to never lose focus on providing your people with the best care possible. We also ask that this facility be a place that people who need us the most will be drawn to, so that we can provide them the care that they need. We ask for a very special blessing on this place and all that enter it. Thank you, and we pray these things in your holy name. Amen. Thank you, everyone. Now it's my pleasure to introduce to you Lisa Middleton, who is the Mayor Pro Tem of the City of Palm Springs. Lisa, this is your time.
Good afternoon, everyone, and thank you for being here. On behalf of everyone associated with the City of Palm Springs, we welcome you to our city. We thank you for the contributions you are giving to our community. The health of our residents, of our visitors, are so important to all of us, and the county's partnership, the county's leadership. We want to in particular thank our county supervisor, Manuel Perez, for his support in creating this facility that will benefit not only the residents of Palm Springs, but everyone throughout the Coachella Valley. Thank you. It was a great partnership bringing this beautiful building into creation.
Mayor Pro Tem Middleton, thank you very much for those comments. You echoed, or you mentioned a theme that will echo throughout the evening tonight, which is partnership. This building represents a true partnership between all of our various partners. My name is Geoffrey and Wagenen. I'm the County Executive Officer, and I have the privilege to introduce tonight some of the speakers and also talk and highlight about some of those partners that made this possible. First, I'd like to, on behalf of Riverside County, welcome all of our guests tonight and our members of the press that are here this evening as we commemorate the opening of this remarkable facility and recognize the work of the providers throughout Riverside County that provide care to patients in our community health centers. This project took an incredible amount of teamwork by several groups of people who worked diligently with one another and together in order to get this clinic opened by the end of June. And as we know, it was a very difficult past 18 months. So in addition to the regular challenges of completing a project, we had to do it during a pandemic. Everyone who helped us achieve this timeline has straightened the foundation and strengthened the foundation of health and wellness for this community by adding another important point of access to care and services. We heard in our invocation about the right care, right time, right setting. That has become a motto for our health system as we build out a continuum of care all the way from our community health clinics to our medical center. And this is one very important piece of that continuum. At this time, I would like to extend a very special gratitude and thank you to the following individuals for their help throughout this project and for joining us here this evening. From Palm Springs, we have already heard from Mayor Pro Tem Lisa Middleton. Also present with us tonight is Council Member Dennis Woods. Raise your hand. Thank you, sir. And our new city manager, Justin Clifton. Justin is in the job now about 2 months or so. Is that fair, Justin? 4 months. I've been in my job 6 months, so we clearly had a lot to do with this, so we can bask in this reflective glory. We'd also like to thank the developer, Rich Borston, who is here. Rich, thank you very much, and thanks to your son for leadership in this, in reaching this conclusion. Our general contractor, Pacific Construction Group, Doug McGinnis, Mark Bundy, and Leslie Bundy. Hands in the back, thank you very much. From our partners at Southern California Edison, Jeremy Goldman. Where's Jeremy? Jeremy, thank you very much. You and your team were instrumental in making sure that we could meet our June deadline. Thank you very much and for the extra work. From DAP Health, we have David Brinkman, the CEO. David, waving in the back as all good CEOs should be. I should take a lesson from you and not be up here. We also have CJ Tobe, Director of Community Health. CJ here? Thank you. Thank you all for your advocacy and support of this project. I also want to thank Cindy Sanchez, the Director of Policy with the Community Health Association, Inland Empire, Southern Region, for being with us here this evening. Is Sandy here? Okay. And finally, I would like to thank and acknowledge the members of the county family who are here with us this evening. Certainly see members from our community clinics. I see folks from the medical center, from public health, from behavioral health, all well represented. I see our Community Health Foundation, our Riverside RUHS Foundation. We also have individuals from our facility management team here tonight to open this up. And now it is an extra special pleasure to introduce to you, as we've heard from our Mayor Pro Tem, the Supervisor for the 4th District, who shepherded this project and is my boss. And so, Supervisor Perez.
Good afternoon, everyone. I'm gonna take off my Zorro hat. My wife asked me to wear it today. Is everyone here vaccinated? Just want to ask, because I think you should. It doesn't matter what I think. As a matter of fact, listen to the experts, the scientists. I think it's important that we get vaccinated according to the science. And thank you for wearing your masks. Thank you for socially distancing. This is the epitome of what we need to be doing and demonstrating, exemplifying it throughout the county of Riverside. So I appreciate the invitation. I appreciate all of you that are here. And I'd like to take an opportunity to thank the leadership of RUHS, who worked hard to ensure this community health center was completed on time. And to the team of providers caring for our residents of this community and this beautiful state-of-the-art facility. I wish each of them and all the community health center workers in Riverside County a very happy National Health Center Week. And it's important that we recognize that as well, because it is National Health Center Week. And what a day to choose to have a ribbon cutting, to open up our clinic for our residents, for our folks during this week. I want to give a special shout out to my former boss, Fred Deato, who's here, because it was through him in which I got my first break working in community health centers when I first came back from college. And it was through our work in which I learned about the importance of access to healthcare, specifically for the underserved. So I'm very proud of the fact of not only serving as your supervisor, but I'm very proud of the fact that we're opening up this clinic, and we got many more clinics that we need to open, that we need to construct, that we need to build out so that everyone has access to healthcare. And that's the theme behind the National Health Center Week. If you think about why even that exists, it goes back to the war on poverty. And it goes to, in my opinion, my humble opinion, one of the best presidents that we had on domestic policy, and that would be President Johnson. And it was through his efforts and, quite frankly, the grassroots, working with the treetops to ensure that people had access to healthcare in their own communities and not having to travel miles and miles and miles to get access to healthcare. As a result of that work, now we have this clinic here. Now you have DAP. Now we have Borrego. Now you have Clínicas de Salud del Pueblo, right? And you have many more others. And I think that needs to be recognized and respect that. The building you will have the opportunity to tour in just a bit is a project we championed to replace the previous clinic, which due to its size was unable to fully provide the vast array of healthcare services that the residents of Palm Springs need and deserve. Now, during the tour, you will also hear more from the healthcare team about the full array of services that are being provided in order to help patients overcome barriers to living a healthier life. I also want to thank, once again, Desert Age Project, whose expansion of the services they provide in Palm Springs made this project possible. And David, you've been a champion as well. And I appreciate your steadfast effort to ensure that access to health care for all our communities, but specifically the LGBTQ community in the region, to be able to have the care. So thank you. You've been a champion. Now, thinking about community health centers and what we do, when we talk about, for example, medical and dental and mental health care services and ensuring that vulnerable populations have access to care, no matter of the ability to pay or not, that's important to recognize. And with that said, today, for example, is also Agriculture Worker Health Day, in which obviously we need to always do what we can to ensure that they have a better quality of life and access to care. And I'm very proud, once again, of what we did as a county. Kim Sharawatari with Jeff Leung and others, your team, to ensure that ultimately our agricultural workers on the east end of the valley had access to health care, from Mecca, from Thermal, from North Shore, from Oasis, from Coachella, and how we mobilized mobile clinics to go out to meet them where they were. And as a result of that, it's my understanding, 92254 zip code, which is that area, has the highest vaccination rate in the Coachella Valley at almost 94% fully or partially vaccinated. And that's because of the good work that we did here. So folks, just want to let you know that this is a beautiful facility. You all can see it, but let's continue to build more. And I know Jennifer Cruikshank, thank you for all the good work you've done, and we always have these conversations. But know that you have an ally in the struggle for everyone to access care, and so let's go get those dollars, let's go get those resources, let's go pass that policy. Let's make it happen. Maybe we need another one in Cotero City. Maybe eventually one day we'll have one all the way out in North Shore. I've been hearing from folks out there ever since I started working for Fred. That was like, what, 20 years ago now, Fred? Maybe one day we'll be able to build one out in Oasis next to the park that they're finally receiving. Eventually, we just got to do everything we can possible to ensure that everyone has access to care. And I think that's also about civil rights and it's social justice. So with that, I have a proclamation here. And I'm going to ask, is it Dr. Leung? maybe Kim, Jen. Why don't you all come up? There may be others that I'm missing. Is there anyone else from the county team that should come up and receive this? Come on up. So on behalf of the County Board of Supervisors, come on up, Jen. Kim. We just want to say thank you to all of you. Thank you to the team. On behalf of Kevin Jeffries, Karen Spiegel, Jeff Hewitt, Chuck Washington, myself representing this district, muchas gracias. Thank you for the good work, and let's go build some more. Okay, thank you. Thank you, everyone.
Thank you, Supervisor, and you can see, where a lot of that passion comes from. Some of you may know or may not know that when you have a community health center like this in an area, it actually increases the life expectancy of the people that live in the community. So this is a tremendous gift. But just thinking back, during normal times, community health centers play an important role in improving outcomes for communities, health outcomes, and reducing disparities. During the past 18 months, though, unexpectedly, that really highlighted the critical role that community health centers can also play during a national pandemic or crisis. For example, when the pandemic first began, our RUHS community health centers worked closely with Public Health and Riverside County to help stand up COVID testing across the region. As part of this effort, RUHS community health center staff and the medical center staff not only assisted with staffing the mass testing sites, but also partnered with Public Health in creating a county-wide scheduling center, starting from scratch, dedicated solely to COVID testing appointments. And then during the next phase of the pandemic, the RUHS community health centers assisted with supporting mass vaccination efforts across the entire region, with both mass vaccination and community vaccination. With all of these efforts, the RUHS community health centers embraced all members of the community and not just the regular community health center patients. From the beginning of the pandemic, the RUHS community health centers have offered virtual visits as a safe and convenient option to all patients. However, the CHCs were actually doing this even 8 years before the pandemic, and they were offering virtual telephone visits, which really speaks to the innovative and patient-focused approach of the team. I hope that all of you have a chance to tour the Palm Springs Community Health Center today. And if so, while you do so, you will appreciate not only that the design is clean, efficient, and functional, but also beautiful, restorative, and healing. Similar to the RUHS Corona, Jurupa Valley, Moreno Valley, and main campus CHC sites, the new Palm Springs Community Health Center is deliberately designed to promote teamwork, integration, and whole person care. For instance, instead of relying upon a large number of individual offices, you'll notice that the Palm Springs Community Health Center features central multidisciplinary workspaces that encourage improved care team collaboration and communication. The Palm Springs site is an excellent example of how different RUHS departments can be offered or services can be offered under one roof in a seamless and integrated manner. In particular, we have RUHS Community Health Center Services, RUHS Behavioral Health Services, RUHS Public Health Services, and this can also serve as an anchor for RUHS Medical Center and Specialty Services. The RUHS Community Health Center services include everything from primary care to pediatric care, reproductive care, prenatal care, well visits, sick visits, same-day visits, nutrition visits, behavioral health integration, dental care, case management, pharmacy, and radiology, just to mention a few. The RUHS Behavioral Health Services include therapy, peer support, psychiatry, substance abuse counseling, and an array of wraparound services. And the RUHS Public Health Services include WIC, public health, nursing, disease control, HIV, and STD services. And the WIC co-location model, the WIC sites throughout Riverside County are co-located with the RUHS community health centers. And this is really a best practice across the state and probably the country. As a health system, our goal is to really get resources to the community in as focused and easy a way as possible for the community to access. And really during the pandemic, we've noticed that the challenges that families have faced really underscore the growing importance of having sites like this to support the community with whole person services available at a single location. We are grateful for this new Palm Springs Community Health Center and for all of the support from the county, our RUHS leadership, the CHC team, the public health team, the behavioral health team, the medical center team, and everyone who's here today, as well as everyone who's not here that made it possible. And we hope that the Palm Springs community will be able to benefit from this community health center for years to come. Thank you. I'd like to now introduce our Community Health Center Board Chair, Mr. Greg Rodriguez.
Good evening, everybody. Many of you know that I work for the supervisor, but I'm wearing a different hat tonight, as Dr. Leung said, as the chair of the board for the RUHS Community Health Centers. I'm actually really, I have to take this off, sorry. I'm actually really honored to be here tonight for this, and I have been the chair for a little over a year now and have been attending board meetings since the supervisor was appointed. And I just have to give a really big shout out to the team that helps manage this incredible operation of community health centers. To Jen and Janelle, Dr. Leung, Joe, and your entire staff have really taken what was a broken system when the supervisor was appointed and really turned it around. And you see not only through this facility, but through the incredible amount of service that our constituents get when it comes to every type of healthcare you could absolutely imagine. So again, thank you for all that you do. Our board is also very pleased with the work that you've done, and I think we express that on a monthly basis. The role of the board of directors for the RUHS Community Health Centers is really unique to a kind of board, because we really are more of an advisory board, and we don't have to worry, unlike as a former board member of Desert AIDS Project raising money all the time. It's really more about how we advise service. And I actually want to acknowledge Chief Patrick, the chairman of the board too, who's here tonight from DAP. But we're made up primarily of patients of our community health centers, so really have a unique lens on what we like to see as far as care goes, but more importantly, what we like to see in facilities such as this. For over 5 decades, community health centers, they've played a critical role in our county and have served an important symbol of hope in underserved communities, and you heard Dr. Leung address that. And what I'm seeing as far as the work of our board, as well as the work of our team throughout the RUHS system, that includes public health, behavioral health, population health, is really addressing social determinants of health and really looking at how we're affecting the overall wellness of our community. That's rich, poor, every color, every race, every sexual orientation, gender identity. That truly is the spirit amongst our community health center team. By offering convenient access like this and an incredible, beautiful access like this, we strive to ensure that those who need the community health have access to it. And the supervisor addressed that, and that I agree with him. We need to build more. And I know Jen shakes when I say that, but and we know eventually we will get there, and especially around the county. But we have 13 clinics throughout our county that serve a vast geographic array, and I know that in some areas, some of those need some improvements, and I know Jen and her team are working very hard to make sure that the entire county is served equitably when it comes to health care. As many of the board members are patients, again, we have a really instrumental role in how we direct the workings of the community health centers. And we really are prideful on the fact that our ideas are listened to, that they're put into fruition and developed to institutions like this as well. I personally am a patient, although due to my HIV status, I'm contracted out through Eisenhower, but the care that I have received in the former Palm Springs clinic has been top-notch, and I would refer anybody to that clinic, and now especially to this one as well. Just for numbers' sake, last year our community health centers, we served over 66,000 patients, and that includes 11,000 children, and that's throughout the county, and especially during what was an incredibly challenging year. As someone who was on the front lines of COVID out of the supervisor's office, I will tell you the role that the community health center system played in the educational aspect, in the care of patients, in testing, and in vaccination, to me was bar none, and is a model and a system that we should be extremely proud of. As we look forward to the future, as a board, we're eager to support RUHS in its efforts to continue to expand their reach, as we mentioned numerous times, and again, are really excited to see this facility. I also want to give a shout out to David and for the patience of DAP. We tried as fast as we could to get this. This is one of the first projects the supervisor and I were approached with, and really, again, appreciate the patience and the partnership with DAP. So with that being said, I want to thank you all for attending this evening. We are going to step out and do a ribbon cutting, and then we'd ask those of you who are invited guests and the media, will be conducting tours. And for that, thank you again for everybody for coming. Appreciate it.
1, 2, 3.